Hi, welcome to your checkup, where we bring health topics from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we're so excited that you can be here with us today. So what are we going to talk about today, Nick?
Well, on our first episode of Your Checkup, that's exactly what we're going to talk about. Your first checkup, or in this case, your baby's first checkup.
Oh my gosh, this is so exciting. So today we're going to use the healthychildren.org, brought from the American Academy of Pediatrics, as inspiration and guidance for our episode. So, Nick, what are we going to talk about first?
So, first and foremost, what do you think the most important thing to bring to your baby's first appointment is?
I think the baby.
Is there anything maybe from the hospital that you should save to bring with you?
Yeah, great question. All kidding aside, the discharge paperwork is extremely important. What's on the discharge paperwork that'll be important?
Lots of important information, a whole kind of general, their birth weight in about 2 weeks. But it'll be important for your baby's pediatrician to track that, what they were, the weight they were born, what they weigh a couple days later, and then in a few weeks to make sure that they're growing appropriately. There's also a lot of information about what happened in the hospital on that discharge paperwork. So what kind of things happen when your baby's first born in the hospital?
Oh, great question. There's a lot that happens in the first 24 to 48 hours that the baby's around. They get their first immunization likely, or at least are offered it. And the American Academy of Pediatrics recommends that babies get the hepatitis B, as in boy, vaccine 24 hours within their birth. And I'll say that it usually happens in the hospital, but if for some reason people want it done at the first visit, I've also seen that done. It's the most common cause of liver cancer, actually, of viral liver cancer. And so that's one of the most important reasons for getting it.
What else do they do at the hospital?
So there are several different screenings that happen at the hospital. And by screenings, I mean normal tests in a healthy individual where you don't expect anything to be wrong. And so in the hospital, babies undergo a newborn screen. And so it's just a little heel stick, right, Nicole?
Yeah, so the newborn screen is a blood test that's actually sent out to the state. It's just a heel test. So if you're listening to this and you haven't had your baby yet and you don't really know what to expect and you hear that there's a blood test, there's no big scary needle in their vein. It's a simple heel prick, a couple blots of blood on a piece of paper that gets sent out to the state. And what does that newborn screen kind of look at?
That newborn screen looks at rare genetic disorders that go unseen by the naked eye. And it's, like we said, it's done in the hospital, but it's good for early intervention to catch things that can be addressed early on, when otherwise, if we didn't do this, they would just emerge and present themselves later in life. And so it really is an astounding advancement in the medical field. One of the other things that happens in the hospital for the baby is the cardiac screen, or the congenital heart screen. Nick, what does that look like for the baby when it actually happens?
So it's not something that's invasive. It's just a couple of stickers on your baby, and they'll look at...
Yeah, they'll look at like how the blood oxygen levels go before and after the certain parts of the heart. And if everything's normal, then there's a really good chance that your baby has a normal, healthy heart. And if it's abnormal, then they just go for another test in the hospital.
What about the hearing screen?
What?
Oh my God.
Oh, the hearing screen. Yeah, so babies actually have their hearing test in the hospital right around the first 24 hours. We were practicing a little bit earlier, and you were describing that there's little earmuffs that the baby actually wears.
Mm-hmm. Yeah, it's kind of like little, or like little baby headphones. I think sometimes there's also like a little sticker on their forehead. And then it's connected to a little machine. They play some sounds, and it measures how it conducts in your baby's ears and measures their hearing.
Yeah. And from my perspective, babies get a couple times to try and be able to pass this test. And if they fail the first time, they get to do it again in about 12 hours. But if they don't pass 2 times, then they go on for other testing, which is best discussed with your own healthcare clinician. Mm-hmm. So babies also can become a little yellow. Is there a word for that?
there is, which you may have heard, is called jaundice. And it might be a little scary to see your baby look like that. Sometimes their eyes can be yellow, which can be a little uneasy looking.
Right. And sometimes it can be something that just happens, but sometimes it's something that needs to be addressed. And there are a bunch of different causes of jaundice or yellowing of a baby's skin. But that's why you work with the healthcare team to be able to figure out when it's too much and it needs to be addressed, or it's something that we're okay with and we can keep moving forward.
What happens if the doctor says that your baby's has jaundice? Did we say bilirubin?
No, we actually didn't describe what bilirubin is yet. So jaundice itself comes from a molecule in the baby called bilirubin.
So what happens if the doctor says that your baby's bilirubin is too high?
Right. So bilirubin is a byproduct of a blood, like what's actually running through your arteries and veins. And adults have it, but so do babies. Babies, though, have a tough time breaking down bilirubin with how they are being so new in this world. And so when a doctor says, oh, the baby's bilirubin is high, they likely will check it more frequently to see if something needs to be done.
And what might have to be done?
Your baby may need to go in essentially what looks like a suntanning booth.
Mm-hmm.
And the reasoning behind that is because UV light actually changes the structure of bilirubin and makes it more water soluble, so the baby can do what with the bilirubin?
The baby can poop it out.
Right, which is super cute. And that's what makes our poop brown, actually.
Mm-hmm.
It's actually produced into stercobilin, which is
so if you have, okay, they don't care. So if you have to go to the hospital because your baby's bilirubin is too high, they're going to be asking you very often, has your baby pooped?
Yeah.
They're going to ask you a lot. The nurses are going to be all about those poopy diapers.
Yeah, they care a lot about it. They care. Sometimes one of the types of bilirubin comes from the baby's eating pattern. And we're going to cover more of it later in the episode. But sometimes if a baby isn't eating enough, it can lead to their bilirubin being high. And so there's a lot to it. But just know that there will be conversations about this immediately after delivery, in the early parts of the newborn care, especially at the first visit. Okay. So, this is a terrific topic for Nicole to dive in on. We have tons of questions here, and we're going to do a whole episode about it. But what's a baby's main job when they get home, and something that they're going to talk about at this first visit?
So the baby's main jobs are eating, sleeping, and pooping, and cuddling with you. That's a big one. We will do a whole different episode on feeding and pooping. But essentially the most important parts that we want you to keep in mind for your newborn is that how fast they are growing and how much they do need to eat. And that's why they need to eat so often when you leave the hospital or when you're at the hospital. You'll probably notice that they're wanting you to feed your baby about every 2 to 3 hours. Even your baby is probably going to cry every 2 to 3 hours because it's ready for them to eat. And then the newborn poopy diapers.
Yeah, what's up with those?
So the first poop, which will happen in the hospital.
What's that called?
It's called meconium.
Meconium.
And it's a little tarry, dark, blackish, greenish.
Oh my God.
Yeah, your poop doesn't stay like that forever. But
no, mine doesn't look like that. If it did, I'd go to the hospital.
You would have to see a doctor if yours looked like that, which will be another episode. And then after your baby passes the first meconium and starts either breastfeeding or having formula, your baby's poop will now look a little like mustardy, yellowy, seedy.
Oh, you
kind
really
of
just
like
ruined mustard for me.
Loose mustard seed. It looks seedy and it's a little yellow.
Seedy. Oh, mustard is. Throw it out.
I love mustard.
So it sounds like
it's my condiment of choice.
It sounds like it's something that it's not what my poop looks like.
It's not what our poop looks like. It's not what your baby's poop will look like in a couple months, but that's the general standard, normal looking formula / breastfed baby poop.
Well, that sounds great. And you can look forward to more on our next episode, which will be about diapers, and feed that baby. Okay, so the next thing that we're going to cover is a huge topic leaving the hospital and when you go to this first visit. It's about safety. So Nick's going to talk about safe sleep. What the heck is safe sleep? Why is it so important? What are your thoughts?
So safe sleep, or what people call back to sleep, is kind of the slogan for this whole safe sleep campaign.
Why is it important?
So it's important. The kind of hard and fast recommendation for safety and sleeping for your newborn is on their back with nothing else in the crib, nothing around them, no toys, blankets, pillows, other people. They should just be alone and on their backs, either swaddled in a sleep sack. What are the risks associated with not following safe sleep recommendations?
There's evidence, like they've done studies and we know that it increases the not doing safe sleep increases the risk of sudden infant death. It's hard and fast. It's clear in the literature, and it's easier said than done. And as we're talking about it, I'm seeing my bias when I go into a room at 5 a.m, seeing a new family and talking about safe sleep. I mean, it's challenging to get a baby to sleep. We were talking a little bit about co-sleeping and how it's very common.
Yeah, it's very understandable why you would need to sleep with your baby. If they won't stop crying, they'll only sleep on you or with you or next to you. But it's very much not advised to sleep with your baby.
Right. And you may have every intention in the world in following this recommendation, and say you're just cuddling and it's 3 a.m. and you just got done feeding and you nod off to sleep and so does the baby. The key piece here is that they don't have the motor function to be able to unobstruct their airway. If something falls on them, if they fall, and then that's where the trouble comes in. And so that's the recommendation, is that a baby should be on their back, perhaps swaddled, but with nothing around them, including toys, loose blankets, pillows. I mean, we've been seeing things online where it's like me in the 90s and it's this baby who's like...
We know that your parents put you in the crib with 1,000 different themed pillows of whatever your nursery was. We're not doing that now. It's not safe.
It's not in vogue. Another thing that actually is covered at the pediatric visit, but is regarding mom, is her mood. And so something to obviously talk about is the postpartum mood disorders, including postpartum blues and postpartum depression. Postpartum blues is it's a mood disorder that comes up very frequently after delivery. It comes up in about 2 weeks and resolves thereafter. Usually isn't treated with medication. But if you're experiencing something that looks like depression, your mood is down, you're not liking to do the things that you don't like, that you used to like to do, you feel overwhelmed and stressed, this is the type of thing that your doctor, whether it's you, the mom, or the pediatrician who can reach out and get help, want to know about.
And it's also very common, right? I mean, it's a huge hormonal shift.
Yeah.
And if you think about just kind of how you feel even around your period, or if you start a new birth control, which isn't even the same magnitude as having a baby and everything that happens after that. What can be done with moms who are experiencing postpartum depression?
I mean, there are always things to do. There are medications. They do take a little while to start, though there are some newer meds that we won't talk about, but there are some newer meds that have a quicker onset of action. And we can definitely dive into a full episode, but there's also therapy. There's support if you reach out. And that's a key thing, is that if you feel something is wrong, and that's what I always tell my patients, like if you think something's wrong, reach out, because there may be something for you. So between therapy, medications, and reaching out for help, those are definitely things to do. So the next thing we're going to talk about is fever. What's the number?
100.4.
100.4. Fever is 100.4 degrees Fahrenheit. Mm-hmm. It's extremely important for a baby. It's an emergency, actually.
What should you do? How do you know your baby has a fever?
This is a good question. I usually tell people when their baby is acting differently, And it's challenging in a newborn because, I mean, like Nicole said, they're eating by this eating, drinking, sleeping, and pooping. That's their job. If they're doing any of those worse, it's worthwhile to check a temperature. And I know we were talking that there's like before we started recording, is that there are like digital ones, ear temperature.
Like the temporal ones that you stick in their ear. Like I think Tylenol makes one. The most accurate way to take a newborn's temperature is rectally or in their butt.
Up the butt. Yeah, no, that's the best one.
The most accurate, and you really don't want to be even walking the line of, does my newborn have a fever? Do they not? You know, it's not like us taking our temperature and we could be 99.9 or 101, you know?
Yeah.
Because those are very different things in a newborn.
If you notice any sort of temperature being off, check again. I mean, we'll give you the time. Give it half an hour. Give it an hour. Check again. Do not give Tylenol. Do not give medicines. Call the pediatrician and likely head to the emergency room.
Yeah, that's most likely what they'll tell you to do.
Right. That's what I would tell you. And what do they do there is another thing. They do a bunch of different tests, and that's why it's important, because there are a lot of people, a lot of really smart people who look at this exact situation and decide how to do and how to evaluate these. And it's best to trust them in this important time.
What are some of the things that could be, just kind of generally speaking, that could be causing a baby's fever?
Yeah. I mean, these days a viral infection, like a upper respiratory infection that like you or I could get, like you had last week.
It's probably most often, like especially if you have a newborn during cold and flu season. If your newborn is not your first newborn and you have toddlers, your toddler will be coming home sick and giving that virus to your newborn.
Classic story.
Yeah.
UTI by the book is probably the most common one that they acknowledge, for which they need urine testing. The most rare, thankfully, is meningitis, which is an infection of the lining of the brain. It can be treated.
But it's the scariest one.
And so that's why you need to go to the hospital when your child has a fever. So what's the number?
100.4.
It's not a radio station. It's a number. And we're doing Fahrenheit here. So 100.4. That's a fever in newborn. Call. Go to the hospital. Okay, great.
Great.
So our last topic that we have here is how to handle the umbilical cord. What is the umbilical cord?
It's where their belly button's going to be.
Yeah, it's cute. It's where the belly button's going to be. But, you know, when the baby is getting nutrition from mom through the placenta, that is where there's a cord, and that's what that is. And it's cut when they're born, and then it's clamped and kind of left there, and often not talked about, and often left with a lot of questions.
Yeah, just...
I'm a new parent. I want to rip it off. Should I rip it off?
No, you're not going to rip it off. It's not a scab. It's not like akin to a pimple to pop. Just don't touch it.
I'm really excited to give my baby a bath.
You can wash your baby. You can't soak them in their cute little tub seat that you just got them, or that you got at your baby shower, that you're so excited to give your baby cute little baths until the umbilical cord falls off. Wait until it falls off. It could take up to 3 weeks. That's normal. And then when that thing falls off, get ready for bath time.
Yeah, then you can dive in. Not submerge the head. But and then I would say the only medical things, if things go awry, and usually they don't, is if you see what looks like pus or redness around the area, give a call into the pediatrician, bring it up at one of the visits. There are a few of them coming up in your future, which we're also going to have an episode describing about what that looks like, because it's a big adjustment. So all in all, it sounds like for umbilical cords, they fall off on their own. In the meantime, we shouldn't submerge the baby into a bath until it falls off on its own, and keep an eye out if it has pus or it's red, because it might be infected. Does that sound about right?
I think so.
Okay. So we're so excited that you were able to listen and join in with us today. We're going to have a few upcoming episodes, including other pediatric talks, discussing things like diapers and feeding. We'll have a separate conversation about postpartum depression and mood disorders. And we're also going to expand our topics, given in family medicine we have other interests and we have a wide, broad audience. We'll continue to expand into other health topics that may affect you, someone you love, or a neighbor. And so thank you so much for joining us today. Make sure that you subscribe, rate, and review wherever you listen to your podcasts. Follow our Instagram, Your Checkup Podcast. And most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye. This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.